Dr. McCarthy here. Today what we're going to do is go over chair squats. It's a more advanced exercise that we give to patients, but the reason why we give this to some of our patients is because they have an instability in their low back, and bending and lifting will flare up their low back. So what we want to do is teach patients how to get the weight, their own body weight in their hips, and get down low to be able to somewhat bend and lift something. So the first thing we do is we just go to a chair and we sit down and we come up without our hands. Pretty simple, pretty easy. The weight is all in our body. That is the exercise. So if you look at it from the side, what we do is we'll go more in depth with them in the sense of we want them to sit their butt backwards, not bend their knees too far forward over their legs, and keep all the weight back into their hips and butt area. And then when they push up, they should be pushing up through their heels to stand up all in one motion. It's not lifting up and rocking up with the back. It's not doing this. We're just teaching them how to use their own body weight to come up and come down. And this is a great exercise because people can do it at home with no weights. Once they get this exercise down, the ability to pick up things off the ground without bending becomes a lot easier. They won't complain about knee pains and stuff like that. They'll be able to just bend down and come up.